so many people that are interested in engaging in more advocacy, and in particular focusing a bit more on how you can work with the media and use media relations to support your advocacy initiatives. And really just so some of the pieces that we will cover today is why advocacy, why is it even important for people who have either lived with cancer or are living with cancer right now to engage, why media relations, and why is it an important tactic to use when you are doing advocacy, how to effectively engage with the media, looking at using social media to support your advocacy, and then just providing some examples of ones that CCS done and others have done involving media and advocacy. To start, what is advocacy? Advocacy is the act of speaking, acting or speaking in favor of a cause in pursuit of an idea or policy. It is really about trying to influence outcomes, including public policy and resource allocations. So this could be examples of either there's a health access to a certain medication you want, different policies that maybe will affect screening or testing, and really making decisions about how government does spend their money within the political, economic, and social systems. And it really is, and this is where it's important for patients, it's about telling your story, and it's really important to hear that voice, and telling someone in government so they're compelled to do or not do something. So why advocacy? All governments are faced with competing interests and concerns, as well as policy priorities and fiscal challenges. So basically, if you engage, you will be heard in the process, and if you do not engage, your viewpoint, there's no chance that your viewpoint will be heard. So it really is important that everyone from all different perspectives does engage in some way, or else you will only hear one side of the story. And why media relations? Well, really, media is a conduit to have your voice heard. The elected officials, those in government, really do pay attention to what are the stories that are being driven to the news, and so does the public. They listen to what is happening there. We do know that media coverage gets the attention of decision makers, and that decisions are changed or altered based on public pressure or what is happening through the news. So another thing, aside from making them, compel them to do or not do something, it can also help to bring your issue to the forefront or raise awareness to something that they may not have been aware of previously. And it really is a powerful tool when you're looking at advocacy, and it can really have an impact on affecting change. So it's something that is good to learn how to do it properly and effectively before you consider working with the media. So what do we mean by the media? And I will say media has changed from when I first started in journalism school many years ago, so I'm probably dating myself for everyone here. But really it used to be traditionally the newspapers, radio, TV stations. But what has really changed quite a bit in recent years is the proliferation of online news. So those that we see, whether it's blogs and opinions on that, online news channels, or those traditional media outlets' online presence itself. And that is a space where it's opened up a lot more for people to tell their stories because there's just a lot more channels in the online space to do that. Here's just some examples of some of the media outlets that you've likely heard of. You may read, watch yourself. With that, there are some that are obviously, I'll say, more influential than others for helping to shape opinion with government. The Globe and Mail, obviously, as a national newspaper, one that's quite respected. The other one, point out, is the Toronto Star, which actually has the highest readership in the country and is one that they have put more resources than some other outlets into investigative and other forms of journalism. So they would be considered, I think, some of those top tier outlets or the very influential ones when you're looking at advocacy in government. So working effectively with the media, it's really understanding how the media works so that it compels them to cover your story. So that's the other thing, and particularly if you are based in a large city like Toronto, there's a lot of competition for what are the stories they can cover. There are less actual reporters doing the coverage than there used to be in the past. A lot of people out trying to interest those for that limited space in it. So it's really about trying to understand how they work so that you've got the best shot of interesting the media in your story. And really how to effectively engage the media really comes down to three principles, and it's really about cutting through the clutter. And so it's to ensure that it's timely and new, interesting and relevant, and I think this is something that's really important when you're dealing with health issues in healthcare, is that it incorporates a human interest angle. I'm now going to turn it over to my colleague Alyssa, who's going to give some of these examples and explain them further for you.
Hi everyone, thanks for joining us on this. And so I'm just going to walk you through a few examples of what makes a news story work. So something that's timely and new. So Angelina Jolie last year had both of her breasts removed in a double mastectomy based on her previous indicated genetic predisposition towards breast cancer. And then more recently, she had her ovaries and fallopian tube, her ovaries removed as well. And so this was obviously timely, new in the health sphere as well. It's something that obviously Canadians covered as well, and they looked to experts for their advice and opinions on the story. So even say if something happens in the broader spectrum of healthcare, but it's related to your particular issue, say for example ovarian cancer, you might want to speak to a reporter or seek them out because likely they'll be doing a story on it, especially if you have someone famous. So if you have somebody internationally famous who's has a disease in your space and something has happened recently or they're advocating for something, it's quite possible you can spin that off to make a more local story that includes your particular viewpoint and a local viewpoint. So that's one way you can consider doing things that are timely and new. And of course, your own timely and new and newsworthy items as well. This just happens to be a good example of one where local people leveraged an international story to provide interesting context that's new for them. So, and again, so we said new and timely and interesting and relevant. So what is your news? Why should people care about your news? How does it impact other people? But then they also want to ensure that stories are relevant for their audiences. So how does your story appeal to the audience of media you're targeting? Are you looking at a national story? Are you looking at a local story? And it's important to make the distinction because often people will come to us and say, we would like our story on the front page of the Globe and Mail, and we say, well, that may or may not be appropriate. What's your story? We want to ensure that we are giving the best advice to folks. So obviously, if we don't think it's a national story, we don't think, there may be other opportunities to engage. So really know your audience. You want to know who you're speaking to and who you're going to go out to and what you're going to tell them. And I previously also, like Laura, have a background in journalism and worked in community newspapers, and sometimes those can be some of the most effective vehicles there are around. They're one of the most widely read media in business, but often people think, no, I want the front page of the Globe and Mail. So not to say that you shouldn't have the front page of the Globe and Mail, and often there are stories that will get that, but just to look at your various options and find which is most appropriate. So an example we have here is around doctor-assisted suicide. This was a Globe and Mail type story for sure. This was, Laura and I both worked with a group called Dying with Dignity to help them get media coverage around their new poll, which showed that doctor-assisted dying, they said suicide here, of course, but physician-assisted death was supported by over 80% of Canadians, including physicians and those with religious views as well. So this was big news because it had previously been portrayed in the media as a 50-50 split. So that you had those folks who were against it battling those folks who are for it, and this put some new quantifiable data on the table. So the reason we like this one is because it is in fact both new, and timely because they were working on a Supreme Court decision the week coming up after. And in addition to that, it had really relevant information for Canadians. So a lot of people were thinking about this, but thinking, oh, I don't know if everybody agrees with this. Well, it turns out most people actually did. And they really were able to hang it on that news hook of having that new piece of information. So you won't always have a national poll that has, a stunning revelation. But when you do, it's a great idea to try and go national with a story like that and get as many members of the media as possible. And then we want to talk about the human interest angle. So we talked about the big pull and all the folks who are in support of physician-assisted dying with our previous example. But we also recognize people are drawn to the stories of other people. You're looking for big personalities, people who can be those news hook that draws media in. So for example, for that one, with Dying with Dignity, we actually had a woman who had MS, and she was part of the news conference and media stories, and she had several features of her own there because she was telling the human story. She wanted, in fact, the right to die on her own terms, and she was willing to speak up and talk to media and do one-on-ones and videos. And so there was not just some sterile numbers, there was also a human face to that piece as well. And we can't emphasize that enough when it comes to patient groups, and really telling the story of how you're affected by various political decisions. So I'm going to hand it back over to Laura, who will provide some tips to effectively advocate through the media.
Thanks, Alyssa. And so the first one is really when we're working with someone to help them with their advocacy through media relations, is really helping them to figure out what are their messages that would be they need to be delivering. So what is it that they want to say, how you want to say it, and what you're ultimately asking for. So you've got to have a good sense of what your advocacy ask, as we say, is, because you don't want to waste the opportunity you have with the media and not have something to do with what you're ultimately advocating for. If you're not, you get very limited time once you are speaking with a reporter or a cameraman, particularly if it's broadcast media. And if you don't have key messages in an ask clearly defined beforehand, it's difficult to actually get the point through, and it can get lost. So if anything, is to do that preparation to make sure you know what are the most important things that you want to say and want people to remember. That's what you need to focus on for a media interview. And the other piece is, and this may seem very commonsensical, but really make sure that your media relation activities align with your other advocacy activities. Don't be at cross purposes with yourself. And so really that's an important thing for an organization such as CCSN or others, is to have a real clear sight to what their advocacy plan, how media supports that, how social media activity, how this may be working with letter writing campaigns or actual meeting with government officials, is really just making sure that you know how it's all working and that the timing is coordinated so that you're as effective as you can be. And even for stories that don't directly address your issue, they can just create awareness and set the stage for the discussion you want to be. So perhaps there's not been as much attention or maybe focus on a particular type of cancer or a particular demographic that's impacted. Being able to shed light just broadly on that space allows you to go in and to have further discussion with government on the particular issues that do impact you. And then this is something reinforces a piece that Alyssa had mentioned earlier, is that you want to make sure that media you're speaking with reach your target audience. So you're strategic about it as well, that if you're trying to influence the provincial government in Ontario, you may be looking at, in particular, the Toronto-based media, or you may be looking at the media and the home riding of an important minister. So for example, the Health Minister, Eric Hoskins, in Ontario right now is a Toronto-based MPP. When you're looking at media to particularly influence him, that's of importance. But when Deb Matthews was our Health Minister here in Ontario, a London-based MPP, we sometimes have looked at tactics that were maybe looking at media in the London Free Press or media in her hometown, because often politicians do pay particular attention to what's happening in the community that they represent at government. And now we're just going to cover some of the tactics on how to engage the media. One, and this is kind of a standard bread and butter of media relations, is to issue a news release. Again, you have to have some news, so something that is making it timely and why you're doing it there. Sometimes it's softer, and it may be something like an awareness day, or it's breast cancer awareness month, or something like that, and what are activities you're doing. It may be something about support for a research discovery or different an event you're holding. But that's just a very standard tactic to send out a news release to the media you're targeting to let them know what you would like them to know. And Alyssa's going to cover a bit later just how social media can help support this as well, just for our newer age of advocacy and media relations. Another one, and this is something that I think people sometimes overlook because they want to go for the big news releases and press conferences, but it's one of the ones that can be the most effective if you do your homework. And it's directly pitching a story to an individual reporter who has an interest in the topic. So how do you know if someone has an interest in a topic? Look and see what they're covering. The major news outlets all do have reporters on beat, and they all will have a health reporter. There was a while that Lisa Priest, formerly of the Globe and Mail, she's now with Sunnybrook, she had done a whole series on breast cancer and various pieces with that. You would have known from reading her work that that was a particular interest to her. Sometimes reporters in different types of columns or that may reveal a part of their personal story, which makes that why, so maybe a family member that's been impacted by a disease, their own personal experience. That makes you figure out, oh, they have a particular interest because it's really impacted them. And you're more likely, if a reporter has a personal interest in something, they're more likely to cover it if it goes with that. Holding a media event or a press conference. Now, this is one that I do generally counsel to do it sparingly, and particularly if you're in a large media market like Toronto. So Toronto is for the biggest and busiest media market in Canada. There's just so much competition and so much going on that actually getting people to an attend event, it has to be a pretty exciting or newsworthy event. You've got a lot more leeway in smaller communities where you're not competing with as many other activities, so you could possibly do this. But holding a media event, you basically want to use as a rule that what would they gain from being in person at the event that you couldn't provide to them via email, writing, or phone? So this may be having a variety of spokespeople available in one spot, that it does happen to coincide with a particular time event that you would want to invite people to. So I think it's just to look at the criteria and to see, oh, what we're holding, does this work and make sense to hold a news conference? Because it does tend to have a lot of work to go with it as well. Another thing is you can consider responding to relevant news items with a letter to the editor. I'm sure you've all seen whether it's editorials in the paper, different other opinion pieces that are there, or maybe just something in the news. It is a quite easy and fairly simple thing to do. You stick within a certain word limit generally, and you have to respond pretty much the same day, which have a shot of getting it in. So that would be just something that if you really want to respond to a particular one, is that, and it's a very well-read section. People who read the papers do tend to like to see who's writing their letters to the editor. So that's just a way for you to engage within a particular issue that is relevant that day. And another one which takes more work, and it works quite well if you have someone that's either credentialed as an expert in a particular area, or you're an organization that represents a particular voice, for example of CCSN representing cancer survivors, is to submit a piece, an opinion piece from a perspective that makes sense that your organization or a physician or someone is providing on a topical issue. So again, you need what is called a news hook, or something that would make the editorial page editor want to run it then. But that's another way to take a position on something and put it out there for others to see. And another one, which this again I think is something that is more related to an organization versus an individual, is you can request a meeting with the editorial board of a newspaper. So every major newspaper, although there have been some cuts recently in some papers, has an editorial board, which is made up of staff of the paper as well as some other individuals that help form what is the stance or opinions of the paper on different issues. And an editorial board meeting provides an opportunity to go and educate the editorial board of the paper on a particular issue. So this may be something that, say, in the case of the physician-assisted dying example that Alyssa was speaking about earlier, that was a very topical and political issue that had quite a bit of play in the media. If you were to bring in experts from different perspectives, from the physician side, the patient side, etc., you could go in and educate the paper on the issues that impact that. So that's something that's more issues-based and from an organization, but it's another way to really take advantage of educating both the editorial page staff as well well as key reporters of the outlet that you're educating on an issue that's relevant to you. So again, when you're looking at, you say, I've got an idea and I think I've got a story that would be interested. How do you know who to approach? Do you know if it's a national or regional newspaper, a community newspaper, television station, or radio station? So not every story is the best fit for every different type of media. So you want to make sure that you are choosing the right one for you. One, it's speaking to the right person at the outlet. So if you figured out, you know what, I've got a local story and I think it's a good one for the daily paper in my city. So what should you do? So one thing, you do your homework and you reach out to before you reach out to the outlet, you look and see who are reporters who may be interested in my story and who maybe may have covered things that are like it, and also see if you can tell if anyone there has been personally affected by the issue there that. And it's one thing I've seen just in having done a lot of work with those who are living with cancer as well as cancer organizations, that often you will see different people in the media, whether they're participating in the Run for the Cure or different events, they often will disclose sometime from those activities that it's something that's personal to them. So that's something to take note of, as we talked about before. You also need to know that there's different roles within a media organization. When it comes to interesting someone to come and cover an event or that, it's the assignment editor, both at TV, radio, and newspapers, who decides who they're going to dispatch their cameras, their reporters, etc. to that day. So that's really who you're pitching to for someone to come to your event. It is the news editor who decides what is going to be published and what is particularly relevant that day. And then health reporters are those that you could pitch directly pieces to, and they're really responsible for researching and developing stories that are particularly focused on the healthcare space. So knowing what time of event or story you have, just knowing who to contact at that media outlet will give you a better chance of success. Now, most of the major publications do list on their websites who are the reporters who have different things with their email addresses, etc. It's not a state secret in that. It sometimes gets a little more difficult at broadcast outlets and that to know who to actually contact, and that's a lot of work that, say, if you're working with someone in public relations like an agency like we are at Hill Knowlton, is that's a big area that we assist with people, is knowing who and when to reach out to them. Now I'm going to turn it over to Alyssa to talk about something that I think where we're seeing an increasing opportunity for really engaging your advocacy and supporting it through effective use of social media.
Thanks, Laura. So I'm sure you're thinking in all of this traditional media, well, what about Twitter? What about Facebook? How do we make sure we're still part of that conversation? And in advocacy, it's very important. You do want to make sure you're aware people are talking about it. And social media can help to advance your cause. So there's a number of channels now. There's Twitter, Facebook, Instagram, LinkedIn, Vine, Snapchat, Yik Yak, all kinds of new things. Every other day there's another social media app. But the ones I've listed here are pretty much still the big ones. And in particular around a lot of health organizations, you're looking increasingly at Facebook, where you have an older demographic who is more likely to face certain health challenges in general. But certainly that could be relevant and useful on many other social media channels. So it's a little bit about knowing, again, as always with traditional media or social media, who is your audience. So the great thing about social media is that it does provide you direct access to a lot of decision makers and then also potential supporters and advocates for yourself and your organization. So some people have the kind of stocked Twitter or Facebook accounts where they post official things, and then some decision makers are far more engaged and say all kinds of things, and some things that get them in trouble sometimes. But they are one of the most useful to engage because they are interested in having a direct conversation with their constituents and others in the media as well on social media. And it's real-time engagement. So instead of waiting for a letter, you could be tweeting at a minister saying, are you going to do something about this? If you so choose to be that aggressive in your approach. So it's definitely a new wild world of advocacy on social media, but how do you use it? How do you know what's right for you? Well, that is the big question. So is it the right medium for you? I would caution that it could be, but you must be prepared. It's, I think, one of the biggest mistakes on social media I see is that people don't have a good understanding of what their strategy is or what their goal is. They simply set up an account because you're supposed to have an account on Twitter, on Facebook, etc. And it's great to make sure you have a presence, but you have to think about what are you going to do with that presence. So I would recommend that it's critical to have a specific goal and strategy. Are you just raising awareness? Are you engaging in advocacy? Do you have a number of touch points you want to reach? Do you have specific people you want to reach? Is it an issue? Is it just overall broad awareness? And again, you really need to understand your social media audience. Which demographics are you trying to reach? So if you are trying to reach influencers and advocates, etc., so people who are talking about these issues and have some influence on decision, you might want to be on Twitter. That is the place where people are talking about things in real time as they happen. And it's actually a smaller world than you might think sometimes. There's a very dedicated group of tweeters among media and among other decision makers as well. But if you can get their attention, it can be quite fruitful. For example, I used to work at an organization where we were trying to get attention for an issue around a hospital closure. And it was, we sent out a press release and not much happened, but then we also tweeted it. And then someone else retweeted it. And then they got in a back and forth war on Twitter with Andre Picard at the Globe and Mail. And then the next day it was a big story. So it's an interesting way to engage and sometimes can be quite rewarding. And again, so you really want to ask yourself, how do you want to engage? If you are, for example, we've done with many patient groups and clients trying to engage on Facebook around issues, because a lot of people consider Facebook part of their daily lives. They check what's going on with their friends, they check what's going on with their family, but they also see the promoted posts that come in Facebook, and I'm sure you've seen if you have an account, they scroll in among all the other posts from your friends and family and tell you a little bit about an issue you might be interested in, and maybe you click on it and maybe you find out more. So that's also an interesting way to get engaged, and that's something that we've supported many clients with as well. So those are kind of the bigger options when it comes to advocacy. I'd say things like Instagram and LinkedIn are a bit newer and haven't really been leveraged as much for advocacy so much as brand awareness at this point, or LinkedIn on certain professional issues. But that said, things are constantly evolving, and so it's always interesting to keep on top of it and see what innovations can be made. But with the big two, Twitter and Facebook, really, as I mentioned, if you want to engage with thought leaders in media, keep up with current events, start debates or conversations with people you may or may not know. For example, you might want to make Andre Picard of the Globe and Mail aware of your issue. You could say, he's a very frequent tweeter. You might be like, are you aware of this, Andre? And you tweet at him, and maybe he'll retweet it, maybe he'll read it, maybe he'll get back to you. But it's a good way to actually build relationships with some of those thought leaders as well. If you're a useful source of good information to them, even if they don't tweet you, even if they don't write a story, it's great to foster those relationships in this way because it's real time and they'll be like, oh, great, thanks for the link. And then they'll know something and they'll remember you and maybe follow you back. But again, the typical user is younger. It's female, early 30s, university educated. That said, a lot of your influencers may fall into that category, may not, but it is a slightly younger demographic. But again, it's the one that probably contains your thought leaders and politicos, if you will. And when you do use Twitter, there are some best practices. If you just tweet a sentence, that actually doesn't get a lot of traction. Unless you're quite famous on Twitter, you need to use things like hashtags, which basically indicates what trend or what issue you're talking about. Tweeting at people at their addresses so that you engage them, and that means they will definitely see what you're tweeting, so that alerts them that someone has mentioned them. Or tweeting photos. Photos get 30% more pickup than any other medium on Twitter. So it's still the potential for visuals there can be really powerful and increase the reach of your tweets. Now on Facebook, again, that's more of connecting with your friends and your family, sharing some more personal information, connecting around interests. Your average user age is now 38, and they're checking it daily. This is actually interesting. The number of younger users of Facebook has decreased dramatically. However, they're being supplanted and rapidly by those who are 35 to 44 and older. So you're starting to see folks who are older, and also a large percentage of boomers who are now starting to join Facebook. I'm sure you all, if you have really family members who post things, I mean, my mother's on Facebook, and so I start seeing more folks of her age using Facebook, and some of the younger people dropping off and going over to Instagram or Snapchat or more immediate places. So again, knowing your audience is important. So say you've decided you want to be on social media, say you've decided this is a good idea, we should be there, we should be doing it, maybe you're doing it already. There's a few things you should really consider in terms of having an effective social media presence for advocacy. So your resources. Do you have the capacity to monitor social media channels? I know Matt at CCSN does a great job, and he's actually really knows what's going on in the social media channels at CCSN and monitors those regularly. But you may or may not have the capacity to do that. So how often do you actually want to engage? Authenticity. Are you speaking to your audience in a real voice? And that again matters, because if you are just auto-generating some tweets from time to time, and they may or may not be relevant to what's happening in the sphere, it can seem tone deaf, and people do then know. They're like, that's not a real person, and they're not actually engaging in the issues. Or even if it's an organizational Twitter account, like, well, that person's not, that organization isn't really on top of what's happening. So they want to know that you're thinking about things and engaging in a real way. So that's responsiveness. So are you responding to them as well? So if somebody tweets at you and you don't get back to them ever, you've lost them. They don't think that you actually, one, you may not exist as a real person. You might be a bot or an automated tweeter, or else they might just think that you're not that interested in having a discussion with them, and so you can lose potential advocates or supporters or other folks in that way. And especially if it's, say, a member of the media tweeting you, you've lost a real opportunity. So you need to know if you're going to be willing to engage that way. And timeliness. Are you on top of the issues? Are you engaging as events unfold? Are you tweeting about whatever's happening most recently? For example, if there's the other night when the NDP won in Alberta, if you're talking about something that's not the NDP in Alberta, I guarantee you that will just not get heard amongst that noise at all. So when the atmosphere is actually cluttered with other media going on in social media, you actually need to really be reactive and think about, oh, okay, is this the right time? Maybe I should think about another time to announce my big thing on social media, because it won't get heard. That was particularly true of the Rob Ford era. If something happened, I guarantee you, if you weren't tweeting
occasionally. Anyways, so I was just wrapping up on our key considerations for social media around timeliness, making sure that not only are you ready to engage, you have a plan to engage, you know who you're engaging, and whether you're ready to make the leap and ensure that you will be responsive and making the most of social media. The only one caution I would say is that having a channel in which you do nothing can sometimes be more damaging than not having a channel at all. So ensure that you use it in the right way and that you are using best practices. There are many, and I'm sure we can direct you to some if you have some questions. So there's a lot to consider, but there's also a lot of reward. And a lot of immediacy for advocacy when you're engaging in social media. So I'll turn it back over to Laura to give you an example of what CCSN has done with advocacy in the media as well.
Thanks, Alyssa, and again, sorry about the technical difficulties. Now here are just some examples to give you some real-life, real-world experience of what we've done with CCSN and some others that have done effectively with advocacy in the media. So last year, about this time, actually more June, we'd worked with CCSN on a survey of Canadians who'd been impacted by cancer. And really what we wanted to see what the main findings were. And one of the big things that we did find is there was not as much awareness as we probably thought there should be, that more and more people are living with cancer longer. It is more becoming a chronic condition for more and more Canadians. And this is something that also has its impacts on how the cancer system works and decisions governments make with regards to cancer patients. It's no longer a you have cancer, you survive, or you don't. It's now one where you can live for many years even with metastatic or advanced cancer. And so really we wanted to use the results of this poll to help educate the government and via the media about cancer becoming a chronic condition for more and more Canadians. So this is something that worked quite well, got pickup with that, and then we then used the same information and stats with government to reinforce the messages. So again, a coordinated advocacy plan that found something newsworthy. The survey hook is one that often works quite well. Did some outreach to media for it, and then have reinforced those same messages, and also did the policy work behind what could need to be changed, what should be changed, so that cancer is viewed more as a chronic condition, and not just that how it was possibly maybe 20 years ago when survival rates and the length people were living with cancer was quite different. Again, sometimes people go, why do some stories get such good coverage and others don't? Well, this is one again, and this is one from an example last year, but it's one where I really think illustrates why some things get a lot of coverage and others don't. This is a story of Maddie Vanstone, who was a young girl from near the Barrie area who has cystic fibrosis. And she and her family were fighting for the province to cover a new drug, which basically it was a very game-changing drug for people with a form of cystic fibrosis, but a very expensive one. And this worked well because you had a very photogenic and engaging young girl. I used to work for many years at the Hospital for Sick Children, and there's something about stories involving children that always appeals to the media and people are interested in. She also worked, her family worked with her local MP, who is currently the interim leader of the Conservative Party in Ontario, Jim Wilson. And he really pushed at the legislature to have this be an issue. And it got even more attention in the fact that they were just about to go to an election. This was right before the Ontario government was went to an election because the budget was not supported last year. And so you almost have what is a perfect storm of political interest, political timing, photogenic and articulate and compelling individual to make a case for what access to these new medications mean to patients. And it was one that then even got the engagement of the Premier on and did play out and had coverage through all the major outlets here in Ontario. So this, and I've worked in health advocacy in the media for many years. It's not one you see every day, but it really does illustrate the various different pieces of the political angle, the human interest, the timely, the new, all together in one that really helped to push this forward. And ultimately, the drug was covered by the province. So media really did help push what was the family's advocacy goals for that. So in summary, media can be a powerful conduit to have your messages heard by your target audiences. To capture their attention, make sure your story is timely and new, interesting and relevant, and incorporates a human interest angle. Align your media with other advocacy activities. Make sure that you are coordinated in what you're trying to do. Be clear with your messages and asks. Know what you would ultimately like to see and what are your key points to support that. Engage media that will reach your key audiences. Know how which is the right media to target. And I think that covers off the overview of our media relations and the advocacy. And now we're happy to answer any questions if you'd like to submit those online.
Okay. Matt, it looks like we've lost the questions option on here. If there's any questions, maybe you could let us know. Oh, here. Okay, we've got a couple questions here. So Crystal has asked, can you talk a bit about submitting news releases if someone has not done that before? And Laura is happy to answer that one.
Hi, Crystal. So yes, so for a news release, there are different options. The lower cost option is one where you would compile what we call as a media list. Which would be email address at the targeted outlets you are hoping to send your news release to. You would draft a news release, which pretty much kind of like you would want to see a news story appear, but making sure that you've got contact information and the various pieces that they would need to know for that. And then you would send out the news release to those contacts and that. So you would have identified the assignment editors, the various media outlets in the area you are to send it out to. Another option, which does cost more, but is one sometimes people do if they want to make sure everybody gets it, is there is a newswire, Canada Newswire, where you can pay to have it disseminated to all the news releases, and you can choose whether it's national, local, etc. But depending on your reach and what you're trying to do, generally doing a media list of the targets that you would have compiled from checking at the different outlets would be how that you send it out. Back in the old days, I used to fax those out, or I even remember a time when you would mail them out. These days, it's pretty much all done via email and electronically sent out.
And I see that your question is about submitting news releases if someone hasn't done that before. If you've also not written a press release before, there are some basic standard tips in terms of how to structure that. We'd really recommend you can look at any number of, for example, Government of Ontario news releases to get a sense of it, but really you want to lead with what is your key point in your ask. You want to explain what it is you're saying in the very first sentence. You want to have quotes from credible authorities on the issue, whether it's the head of your organization, patients, a medical expert, and then you want to give a little bit of background and context around why it's important, and make sure you, again, reinforce at the end what it is you're asking for. So if it's around a funding issue, you can say patients across the country are waiting eagerly for the funding of this cystic fibrosis drug, and at the end say, you know, we call on the Ontario government to fund this drug. So you want to ensure that you have those elements in a press release when you're sending that out. And again, you can send this out via multiple outlets. You don't want to fatigue people. Reporters will essentially look at the first line or two of your press release and then decide whether they want to read any more. So don't bury any information. Make sure it's clean and clear and at the top. In some cases, a lot of folks have taken to putting a few quick bullet points at the top of their press release under the headline so that the reporter doesn't have to sift through the entire thing and if they're not interested in those first 4 bullets. So be concise. Don't make it any longer than a page if at all possible. Okay, are there any other questions? Folks can feel free to type in any further questions. Oh. You're welcome, Crystal. Okay, I think that's it. Unless anyone has any last-minute questions, I'll turn it to you, Matt, to wrap it up. Okay, then. Well, I think that wraps it up for us then. Feel free, if you'd like, to contact us for any further information. You can reach Laura and I at our lines here above. We'll leave that up for a minute, or at Hill Knowlton Strategies, where we work. So thanks so much, everybody, for participating. We really appreciate the opportunity to let you know more about how you can use the media for your advocacy goals. And we hope you've learned something today. And feel free to keep in touch.
Okay, all right, thanks to both of you. We'll just wrap up here. And I want to thank everybody for joining us today, and thank all of you who stuck through with the technical difficulties. We apologize for that again, and hopefully it won't happen in the future. But yeah, I'll just wrap things up here. I'm Matt Handy. I'm CCSN's website and social media coordinator, and I'd just like to thank our 3 sponsors, Novartis, Merck, and Boehringer Ingelheim, for all their help putting these webinar series together, and to both Laura and Alyssa for their great presentation today. And so with that, we'll be back again with another webinar in a couple of weeks, so you can look out for some more information on that coming out probably next week at some point. So with that, we'll sign off now, and we'll see you all next time.